Bismillahirrahmanirrahim. Assalamu alaikum. We will talk about research methodology. So let us start our journey in the research methodology field. Our agenda, we will highlight the difference between types of study design, define what is quantitative and qualitative research, recognize the difference between quantitative and qualitative research, describe the different types of quantitative and qualitative research, and to identify the data collection method of each type. So let us start by what is research. Research is a systematic collection, analysis, and interpretation of data to answer a certain question or to solve a problem or to set a new hypothesis. There are many steps to do research, starting by research question. So we'll start by research question, then define the variable, the sample size, and then we'll have the research design, and then we will end with data management and statistics. There are some characteristics of research question. Research question is very important because it is considered the takeoff of any research. It should be final, it should be feasible, interesting, novel, ethical, and relevant. So we have three terminology. What is research methodology? It is the same like research design. It is the same like study design. So study design is a specific plan or protocol for conducting the study, which allows the investigator to translate the conceptual hypothesis into an operational one. Research methodology is a science, and of course it is an art. We have two main types of research methods. We have the qualitative type and one quantitative type. And of course, we sometimes can do a mixed type of them. So what about the qualitative type? The purpose of qualitative research is to describe condition, explore association, formulate theory, or generate hypothesis. But the quantitative research is concerned about the numerical data under standardized conditions. There are many types of qualitative research like ethnography, ground theory, criminology, or case study. And for quantitative research, we have two main types, experimental type and observational type, and we'll go through these details after some times. So to start or to choose any of these researches, we have to ask ourselves what we want to do, what is our research question, what is the research goal, what is our skills as a researcher, and what are the time and funds for our research in order to choose to do qualitative or quantitative research. So let us start with qualitative research. Qualitative research is a study or researcher study things in their natural setting, attempting to make sense of the interpreted phenomena in terms of the meanings people bring to them. So what about ethnography? It is a key element of ethnographic study is to investigate the way of life of a group of people. For example, the culture. For the ground theory, a ground theory approach does not begin with existing theory, but rather it generates a theory for the phenomenon being investigated. It comes after collecting the data. Phenomenological study describes what all participants have in common as they experience as a phenomenon. In case study, explore a process, a study, or a case. For example, qualitative research is a systematically observing people in their natural life. But how to collect data for qualitative research? We have many types of data collection. We can do group discussion, simulated recall, observation, individual interviews, etc. But the most common types of them is the interview or focus group discussion. Focus group discussion have some setting, should be considered before doing it. It is an organized group of discussion. The method is used to facilitate knowledge, the production of knowledge from the subject. It is interrelational dynamics of the participant between each participant and the other, and the researcher acts as a moderator. So there are some thing to do before doing focus group discussion. Before it, we should state the purpose, why we are going to do this focus group discussion, to develop the focus group guide, to have an IRP approval, institutional review board approval, to select the participant, to have an informed consent from all participants, and to plan the date and time and place, and to get recording equipment, and to train focus group facilitator and note taker of them, and to create a set of questions to be asked in the focus group discussion. During, we have to take care about the role of the moderator and the group dynamics. During, we have to listen carefully. We have to probe for more details or examples, to reflect back and summarize, and to avoid facial or body reaction. After that, we have to analyze the data. For analyzing the data, this is called content analysis, which is a technique for the subjective interpretation of the content of text data through systematic classification process of coding and identifying themes or pattern. There are 5 steps of content analysis. Number 1 is transcription. Number 2 is to read the data thoroughly and then to code the structure, put it into codes, and then resolve discrepancies and to summarize and report. So each data should be collected in a code and then to be able to interpret it later on. So for the qualitative research, there is no comparison, there is no relating variables, there is no proving hypothesis, there is no measuring of the variables. So this is about a short note about qualitative research. Again, what about quantitative research? Quantitative research, as we said, it is concerned with the numbers. So quantitative research is a structured way of collecting and analyzing data obtained from different sources. It involves the use of computational, using statistical, mathematical methods in order to drive results. There are 2 main types of quantitative research, either the observational one or the experimental one. In the observational one, the researcher collects information but does not influence events. But in the experimental study, the researcher deliberately influences events and investigates the effect of the intervention. As example of observational study is to know the relationship, for example, between passive smoking and lung cancer. Another example is to study or to discover the prevalence of peptic ulcer disease among patients with portal hypertension, or to study the relation between the use of contraceptive pills and breast cancer, etc. As regards the experimental research, it depends on what are you going to do in the lab, for example, or what surgery are you going to do, any intervention, or any medications that you are going to use patient and you are going to evaluate your result. So this is the difference between the experimental research and observational research. So in order to classify them, we have the descriptive type, which is case report, case series, or cross-sectional study, and we may have the analytical type like case control study, the cohort study, and cross-sectional study. Let us go deeper and discuss some of them. So as regards the case report, it is generally report of a new idea or new finding or unique finding. For example, previous undescribed disease, or unexpected link between diseases, or unexpected new therapeutic effect, or unexpected adverse event. So this is called a case study. The best example for case study is the Hirschsprung disease. When Hirschsprung discovered 2 cases of babies who have abdominal distension, constipation, and he described that as a case of congenital megacolon, and then after that it came the name of Hirschsprung after Hirschsprung disease, who discovered the disease. We have also from the observational study the cross-sectional study, which is a clinical study design in which the event and the outcome data are collected at essentially the same time. It is called data collected at a single point of time, like this photo, data collected only one time. Cross-sectional study is a relatively short time. It is relatively inexpensive, and it needs no follow-up for the patient. To have an example of it, if you have gynecological clinic and your patient are taking contraceptive pills, for example, and you are taking a vaginal swab to see if they have chlamydia or not non-chlamydia. So you are going to take the swab only one time. So this is called the cross-sectional study. If you are going to follow your patient for a long time and take many swabs, so this is called longitudinal study. As regards the case control study, is an observational design comparing exposure in disease cases versus healthy control from the same population. All patients having the same exposure. It starts with the people who have the disease, match them with control that do not have the disease, and look back to see what about the exposure that they have. Is it the same or not the same? So this is an example of case control study. We start with the exposure and then revise what happened to the patient and then go back to ask yourself, was the exposure that they have affect their health or not? We have also the cohort study. The cohort study started with 2 exposures. We have patients who have exposure to something or risk factor, and we have another group who have no risk factor. For example, if you are studying 2 separate group of smokers and group of non-smokers, so this is the first cohort and this is the second cohort, we will follow them for a certain time to see if these patients will develop cancer lung, for example, after some times or not. So this is an observational study and it is called a cohort study. This is a real example. They studied the effectiveness of influenza vaccine in elderly patients in New England. So some elderly received the influenza vaccine, another group didn't receive any influenza vaccine, and they evaluated the patient after some times how many of this group or that group had influenza attack during the season. We'll go back to randomized control study. Randomized control study is one of the quantitative research. It is a prospective study comparing the effect and value of intervention against a control assigned randomly. So we have 2 groups, a study group and control group. This is the main issue, is to randomize. The control group and randomized group should be randomized. Example of this in a real life, if we have a cactus extract for treating venous ulcer, a randomized control study. So this is a venous leg ulcer. Group of them will have the cactus extract and the other group will have placebo. And we choose those patients randomly. Of course, this is an ethical condition because after we have an approval from the Research Ethics Committee, we are using placebo for some times in order not to harm the patient. There are many prerequisites to do randomized control study. We should design the sample size. We should know what kind of randomization we are going to use. Is it what kind of randomization we will use across the envelope, or we will use a computer-based randomization, or what? We should know, are we going to do blinding? Is it a single blind study, double blind, or triple blind? We have to know the selection of our patient. We should not select patient on basis of bias. We should know the control group, from where we get the control group. We should be sure about the compliance of the patient to avoid any drop-in or drop-out in our patient, and ethical consideration also should be considered highly in this study group. So how to collect data or gather data in cases of quantitative study? Also, we have many ways to gather data, but the most important one is a questionnaire. So the questionnaire could be sent by mail, should be web-based, group questionnaire, individual questionnaire, or interviews. Questionnaire could be structured, which is harder to develop, easy to be completed, but easier to analyze, but took a little bit long time, or semi-structured, which is easy to develop, but it is very difficult to analyze. In order to do questionnaire, we have to define first the purpose of the survey. This is through the research question. We could research a question. We have to define the population that would be included in your questionnaire survey. We can use another surveys after having the intellectual property. We have to keep the intellectual property of other questionnaires, and we have to refer to them. We have to define the scale, which scale we are going to use, either dichotomous or multiple choice or Likert type, like strongly agree, disagree, not agree, and so on. And then we have to do a preliminary questionnaire or to try it on a simple group or small group of a participant, and then we can implement it in a larger group of participants. So the step of doing questionnaire, number one, is to ask ourselves what is a problem or need to be addressed, review the relevant literature, review what you want to evaluate, define the parameters, develop relevant questions, conduct a preliminary study, and then apply item analysis for these questionnaire. In questionnaire design, we have to use the sandwich technique. So we start the questionnaire by praising and thanking the participant, and then asking the main question, and then ending the questionnaire by praising also and thanking the participant. So we talked in this presentation about the different types of study designs. We talked about the qualitative and quantitative research. What is the difference between them? We talked about how to get data to do qualitative and quantitative research, and how to do content analysis of these data. Thank you.